Pop star Demi Lovato rushed to the hospital recovering from an apparent overdose. Despite initial reports, sources telling Fox News it was not heroin, although we do know she, the singer, was treated for opioid reversal with the opioid reversal drug called Narcan at the scene. Dr. Daniel Bober is a certified addiction medicine physician, and he joins us now with reaction. Dr. Bober, thank you so much for being with us.
Thank you, Ainsley.
You're
Great
welcome.
to be here.
We want to shed some light on this because it's clearly a problem. Opioid deaths, #1 cause for injury death in the United States. You know, she's young. So many people look up to her. How can you weigh in on this, please, with all your experience?
Well, you know, Ainsley, this is a horrible epidemic. 120 people a day overdose in this country, and we spend $80 billion a year in terms of healthcare costs and loss of productivity. So this should raise awareness in our country about a horrible public health emergency. And there is treatment in the form of drugs like methadone and buprenorphine, which have been shown to cut the risk of death in half and the risk of overdose. But there's a lot of ignorance in the community, and people don't understand the difference between addiction and dependence. And so, you know, we need to start looking at the way we're treating people and mobilize all our resources.
Well, at first we thought this was a heroin overdose, and then there was a statement from her family saying that, you know, that everything that's being reported is not necessarily true. Then we're hearing from friends that were there saying it wasn't heroin, but we do know that Narcan was used. Would Narcan be used for another drug or a different type of overdose?
You know, a lot of times Narcan will be used during an overdose when paramedics, for example, don't know what the drug is, because you can't really hurt someone by giving them Narcan. But if they did, in fact, overdose on opioids, that is the way to reverse them. So it seems strange to me that this is not heroin or some other opioid. But again, you know, we don't know for sure.
How bad of a problem is this? Are you seeing a lot of, you know, individuals her age in their 20s using heroin?
You know, I see this every day in my office. I see it every day in the hospital. This is an illness that affects people regardless of their status. It doesn't matter who you are. We're seeing it in our communities, and it's affecting us every day. So I see this all the time.
What do you tell parents that have kids that are dealing with this?
Well, that they have to get treatment very often. This requires residential treatment in a controlled setting. And it can be very costly and very expensive, and this is why, you know, I call upon the White House and President Trump to do everything they can to stem the tide of this epidemic. What
are the chances that people can be clean if they do have an addiction, if it has a hold on them?
One of the greatest myths about addiction is that it can't be treated. You know, addiction is not treated the same way, for example, or thought of as the same way as heart disease or diabetes. You know, if someone tells you that they have an addiction, you know, we tend to look at them in a strange way. So we need to erase the stigma of addiction, but the rate of treatment and relapse or remission is similar to things like diabetes and asthma. So we can treat addiction the same way we treat any other medical illness. We just have to be willing to look at people with compassion and not judge them.
I agree. Dr. Bober, thank you so much for being with us. Thanks for your work.
Thank you,
Saving
Ainsley.
lives.